Good morning, travelers, pre-med students, and undergraduates. Welcome to Doctors In. This podcast features top-performing proactive physicians with whom we try to dissect what makes them the best in their respective specialties. We're going to shift gears a little bit into the clinical setting. What does a typical clinical day for a urologist, Dr. Casperson, look like?
I see all ages, all genders. I focus on female. There are 9% of America's urologists are female. So we're quite busy because 51% of Americans are female. And they all have pelvises. Right. All Americans have pelvises, actually. Yeah. So most of them. So I do tend towards female. As far as, prolapse, incontinence, recurrent UTIs, vulvovaginal disorders, things like that. I do a mix of clinic. That's the cool thing about urology. We do a mix of surgery and clinic. That's not good if you don't like clinic at all. But I've got people that I've been taking care of for 10 years. That continuity and to form that relationship with people is available. Whereas in a lot of surgical specialties, it's not.
You really go well and beyond to seek answers from different fields. For example, you emphasize in an interview, and I summarize, evolutionarily, women find it best to have responsive desire, whereas men have more so like spontaneous desire. So I guess, can you please elaborate what this means for the audience and how this applies to urological health?
Sure. The first thing to know when we're ever trying to interpret, historic data is we don't have much, right? We don't really know why we evolved to have the body parts we have put in the order that they are. So a lot of this is expert conjecture. And I think the other thing that's important when talking about sexuality is we tend to stereotype, but we tend to get a little heteronormative and forget that everybody's different and everybody's on a spectrum and kind of all that. So I always just want to lead by being it's not to exclude anybody. Sometimes it's a little simpler to stereotype to get a point across, but it's never meant to offend anybody. But I think what you're leading at is in our society, think of the music we listen to, think of the Hollywood movies we watch, is we're really fed this education of spontaneous desire is the norm, right? But what we know with a lot of lived experiences is responsive desire is actually the norm, meaning I'm not spending my whole day thinking about sex, but once I'm put in a sexual context with a partner that I love, it's a great time. Right. And a lot of those people, whether they're male or female, feel very broken because they think they're supposed to have spontaneous desire all the time. And a lot of that is just not having adequate information and then being fed, what sells, right? Sex sells, top 10 country hits sell, where it's all talking about spontaneous desire and you've lost it and now it's broken. And so we just don't get a great education.
If you enjoyed this short segment, please like the video and comment any feedback. Also, feel free to check out the full podcast episode where we try to ask the right questions to deconstruct study strategies, useful habits, constructive failures, and life lessons. The podcast can be streamed on all platforms.